As I mentioned in one of my short videos, it's a cruel irony that probably the last people who will ever be given psilocybin as a treatment for their mental health problems are schizophrenics, since the prevailing probable delusion among the psychiatric community is that magic mushrooms would probably worsen schizophrenic symptoms since they induce hallucinations and so on. And people think that for this reason it would make a schizophrenic worse. However, what schizophrenia in the true sense is thought to be, the people who could accurately be diagnosed as schizophrenics, it was originally called dementia precox, which means roughly early onset dementia or very early onset dementia. So psilocybin has, in limited case studies, been shown to improve the symptoms of advanced dementia substantially. There was, for instance, a study published in Frontiers in Neuroscience of an 80-year-old woman with advanced dementia symptoms who was given a large dose, crucially a large dose, of psilocybin, and her symptoms substantially improved, at least for a short time. And this makes it a very promising candidate for the treatment of Alzheimer's disease. I believe that in cases of true schizophrenia, there may be a deep crossover there with Alzheimer's also, or with the neuropathology of dementia of some description, like degenerative brain diseases and so on. And this could, of course, be aided by a hefty, heroic dose of psilocybin mushrooms. And the evidence is not there yet. I grant you that. It's not been subjected to large-scale studies or anything like this, and it's only in limited case studies that the evidence is extant. However, I think due to its effects on neuroplasticity and neurogenesis, it may well aid the brain in being able to repair itself. And for my own part, I've experienced substantial cognitive benefits, substantial enhancements to my creative faculties, my cognitive faculties, my mood, my disposition, if you like, from having taken psilocybin mushrooms. It's given me huge insight into a great variety of different things. It's even allowed me to do bizarre things that I never thought I would do. I credit possibly a large part of my skill at things like poetry and art with having experimented with psilocybin mushrooms before. And for my mental health, I would like to take, frankly, these large 5 dried gram heroic doses of magic mushrooms more regularly. And I don't really have a secure enough supply of magic mushrooms at the moment to be able to do that, to be able to engage in that sort of self-therapy. But the efficacy of treating treating obsessive compulsive disorder and post-traumatic stress disorder with psilocybin is now pretty much beyond dispute. It has a great deal of efficacy for treating mental health problems such as that, and indeed treatment-resistant depression also, anxiety also, may have applicability with a great many different mental health conditions. One of the ways in which they're suggesting that psilocybin ought to be taken, what they're trying to do is they're trying to remove the hallucinogenic element of the psilocybin experience from the drug, and they're very much encouraging microdosing. And I personally think that microdosing is the wrong way of going about it. I think that actually what you should be aiming for is a hallucinogenic experience to some extent, and you should be seeking to rewire the brain. I don't think microdosing actually gives you enough psilocybin for it to be able to work properly. And to go back to this case study, this 80-year-old woman who was given a substantial dose of psilocybin, that is where the real power of the drug comes to the fore, if you like. I don't think microdosing is actually especially helpful. I think also, in terms of the training it gives you in hallucinogenic experiences, I think it is one of the safest ways of engaging with hallucinations. And one of the benefits of having those experiences is it allows you to recognize hallucinations for what they are, and it allows you to gain a sense of when you're experiencing hallucination and when you're not, and it doesn't rob you of insight into the experiences, whether or not you have a bad trip. I think bad trips are somewhat uncommon. I've had a bad trip in my time, only one though, and like the overwhelming majority of my psilocybin experiences have been very positive. Um, but yeah, people are afraid of bad trips. People are afraid of taking magic mushrooms. I think like highly unnecessarily. Really, I think it is one of it's been shown to be in the research literature one of the safest drugs you can take, if not the absolute safest. Safer than cannabis, safer than MDMA, safer than far safer than alcohol. And with alcohol being the least safe drug you can take, I think in this research that I discovered via David Nutt, the former government advisor on drug policy, that alcohol is actually more dangerous than heroin and cocaine. And yeah, I think psilocybin it shows great potential in psychiatry and could allow psychiatry to become a more respectable discipline that is able in the future to treat people with methods that actually have efficacy rather than things that, such as antipsychotics, that don't really work that well, such as SSRIs, which don't really work that well. They don't really show much efficacy above a placebo. I think if I read this correctly somewhere, that psilocybin had efficacy in treating post-traumatic stress disorder in 60% of cases, compared with 3% for a placebo. Look at that. That is just a stunning result, is it not? But yeah, removing the hallucinogenic element of the psilocybin experience, I think is misguided. I think people should be aiming for large doses of psilocybin, not microdosing. I had when I had a bad trip actually, I started off by just nibbling a few shrooms. I took a microdose, and it made me feel okay. It did sort of work a little bit for relieving some anxiety and things. And I sort of, colours became more enhanced and things like this. So I was having a very mild psilocybin experience on that microdose. But then I drank alcohol on the substance. And I think this is what led me to have a bad trip. And then I took more mushrooms later on, and I just had the most horrifying experience I've really ever had on a drug. I was really taking the piss with psilocybin, I think, and it punished me for it brutally. And yeah, I think when you take psilocybin, you should have a totally clean, clear body to the best of your ability, to have a clear head about you to the greatest extent that you can manage. And if not, like via the experience itself, psilocybin will clear your head. And so I'd say that if you've been going around in life being too much of a cunt, then psilocybin will punish you for that, and you will get a bad trip. And like maybe it'll help you on a level sort out your cuntish behaviour, but then again, maybe it won't, since there might be no cure for being a cunt. I don't know, but yeah, we need to take this very seriously. Because people suffering from severe mental health problems could benefit from it substantially. People suffering from dementia could benefit from it substantially. My grandmother, for instance, suffers from dementia, so I'd like to see her gain greater control over her cognitive faculties once again, and that would be awfully nice. I think like the drugs she's been given currently, they're really just slowing down the inevitable process of her decline into mental oblivion, really, rather than actually repairing the brain, if you see what I mean, which psilocybin seems capable of doing. So if we're not like going full bore towards this, then in our medicine we're not really doing the best that we can to help people get better. which should obviously be the objective of any medic. But yeah, I think I've said what I want to say about this. Psilocybin has great efficacy for treating a variety of conditions, and should be explored more thoroughly, and should become mainstream as a first line treatment, I think, as soon as humanly possible. So thank you everyone for watching. Bye bye.